Hi, everyone. My name is Dr. John Marin, and I'm the program director for the Neuromuscular Medicine Fellowship here at Cleveland Clinic. And it's my privilege to tell you a little bit about our program. Now, the Cleveland Clinic is a world-renowned institution. It's celebrating over 100 years um, being around, contributing to innovations in healthcare. We actually celebrated 100 years in 2021, and from the very conception of the clinic, its founding fathers thought that there would be these three important pillars for our success, and you can see it there emblazoned on the building blocks of the original building. The motto: care of the sick, investigation of their problems, and further education of those who serve. And it's that further education of those who serve is our watchwords here. We take great pride in this legacy in creating the optimal learning environment for the future leaders in the field, including the field of neuromuscular medicine. And this little clip, this little trailer says a lot.
It's not about money. It's truly about making the difference in the life of another human.
That's what motivates us. It's our sense of purpose here.
And knowing history gives us a waypoint where we can look at the future.
Now, a little bit about our neuromuscular medicine fellowship program itself. It is a 1-year ACGME accredited fellowship program, and there are 3 positions available per year. Now, we have the advantage of being a fairly large program based on the amount of faculty available to participate in the training and teaching of our fellows. We have at least a dozen faculty here at main campus who are neuromuscular trained and participate actively in teaching and education. We have 5 additional neuromuscular medicine faculty that are in our regional locations, and the numbers, we're still hiring, and these numbers tend to grow over time. So to the following stats, where we see over 400 inpatients who carry a neuromuscular diagnosis, and we see over 13,000 outpatients in the neuromuscular clinic per year, and we also perform over 4,000 EMGs annually. So there is a lot of learning opportunities that come with such high throughput. Yes, we are known for our strength in EMG training, and we've impacted the EMG landscape very significantly from our inception. But we also run a full-fledged autonomic disorders lab, skin biopsy and histopathology lab, and neuromuscular ultrasound services. We'll talk more about that in following slides. In terms of the infrastructure on main campus, we have 7 dedicated EMG rooms. We have, in addition, 8+ EMG rooms in 6 satellites and regional sites. And I mention that because this allows for other rotators, like our neurology residents or PM&R residents, to be able to not be at main campus to compete for the same space as our neuromuscular medicine fellows. And that's a major advantage. We do have bandwidth out in the region, so other learners can take advantage of that. We have 7 EMG techs who are certified techs, are NCST techs, with a full complement of 10 EMG techs being our usual, so we have space for 3 more. We have 2 autonomic study rooms at main campus and 2 neuromuscular medicine, I take that back, 2 neuromuscular ultrasound rooms, and we have 5 neuromuscular ultrasound faculties. So there are a lot of opportunities to grow in the exposure to neuromuscular ultrasound here, and this is a distinct advantage of our program. So the way we structure the curriculum is truly beneficial to your training. We kind of use a model that can be described as a bolus and maintenance dose model. In the first month, so for the month of July, you're not thrown into clinic or the EMG lab without preparation. In fact, the month of July is heavily didactics and hand-on workshop um, oriented. So you have a lot of lecture series that cover basic clinical neurophysiology, nerve conduction, needle EMG, the foundational neuromuscular ultrasound basics, neuromuscular anatomy, neuromuscular histopathology, and uh, the clinical disorders that you'll encounter when you start working in the clinics. So this sets a good foundation and basis for you to be able to learn and kind of not start in the deep end of the swimming pool, so to speak. We also are very good about archiving all our didactic sessions. So these are part of an ever-growing repository of electronic resources that's available to our fellows. From the month of August onwards, you're going to be into the different clinics, the adult neuromuscular medicine clinic being the mainstay, but you also have the pediatric neuromuscular clinics that are done weekly, so to weekly specialty clinics like the ALS multidisciplinary clinic. Parallel to these would be services that you may provide for inpatient neuromuscular consultations. Those are probably a couple times per month, but they allow you to learn how to manage some more acute and urgent neuromuscular presentations and see how they are handled on the inpatient side, including the ICU. These are very important sides of the management of clinical neuromuscular patients. About 30 to 40% of the time you spend in the EMG lab, and each week there is a half-day neuromuscular ultrasound clinic that the fellows rotate through. You also have rotations that are at the Akron Children's Hospital for pediatric neuromuscular experiences, and that has been a crowd favorite because of our director there, who is an alumnus of our fellowship program, who's very invested into education and training. The remaining time that you have is dedicated to nerve and muscle pathology, as well as research and scholarly activities, which we'll again talk more about in later slides. Apart from these kind of core offerings, you have other more niche areas that you can seek further opportunities for training and learning. These include more advanced neuromuscular ultrasound, skin biopsy techniques, intraepidermal nerve fiber evaluations, autonomic studies, single fiber EMG, and even for those who may want to pursue a clinical practice that involves the use of botulinum toxin injections or chemodenervation, opportunities can be made to get some exposures there as well. Trainees can expect to perform between 400, 500 plus EMGs during their year of fellowship. We really have not only large volumes, but a great variety and diversity of neuromuscular pathology that comes through not only clinic, but the EMG lab. So you're well versed in multiple different electrodiagnostic protocols. And again, you work with distinguished faculty who take you under their wings in the clinic to get mastery of the bedside neuromuscular skill sets. And with the comprehensive training that we have, you basically meet the requirements for sitting for the ABPN neuromuscular medicine, as well as the ABEM board certifications. One unique and major advantage of being at the Cleveland Clinic here in main campus and doing this program is the ability to see patients from all over the world that come in, many of them fed by our satellite facilities, and these satellite facilities are within Ohio, and some are out of state, like Cleveland Clinic, Florida, Cleveland Clinic, Nevada, and some are actually international locations, like Cleveland Clinic, Toronto, and Cleveland Clinic, Abu Dhabi, in the United Arab Emirates, as well as Cleveland Clinic, London, England. So this is a massive, 6,000 plus bed health system that really sprawls globally. And many of our fellows feel like they've done an international fellowship in neuromuscular medicine based on recounting how many different nationalities they've been able to see and serve during their year here. So it's very redeeming, and it's one of those very gratifying features of doing your fellowship and certainly practicing neuromuscular medicine here at Cleveland Clinic. So we talked about bolus, the bolus month of July, but throughout the year, we string along a lot of maintenance educational nuggets, and these come roughly weekly in various forms. So obviously, we still allow for our fellows to participate and imbibe the general neurology grand rounds, which really state-of-the-art neurology. So we feed that core general neurologist that is a foundation for being a good neuromuscular neurologist. But we also have our dedicated neuromuscular medicine grand rounds, roughly monthly. And also on a monthly basis, we have EMG case conferences where we also look at interesting neuromuscular medicine clinical cases. So all interesting cases kind of come before the forum, presented and dissected and really taken advantage of in terms of learning opportunities as we discuss these in detail. Also, there's the Neuromuscular Medicine Journal Club, where we look at the latest publications and the evolving evidence in the practice of neuromuscular and diagnostic medicine. Apart from those, there are other formal teaching opportunities that are strung throughout the year. These include a roughly monthly supplementary lecture series on advanced topics from the faculty here. Our chair, Dr. Levin, does these high-yield teaching cases. These are cases he's collated over the years and in his many years of experience that really have a lot of great illustrative and teaching value. We have these potpourri sessions that are done. Sometimes it's a lunch and learn with several faculty. Then there's separate in-service exam preparation review sessions with myself and other faculty. We also try to grow the clinician educator aspect of your development by providing these opportunities to work with our medical students. We have 2 medical schools that are heavily attached to us here, including the Cleveland Clinic Lerner College of Medicine. And there's also a lot of different opportunities to teach other junior trainees, including our core neurology residents, and as well as physical medicine and rehab residents. So again, you're able to leverage your more advanced knowledge in neurology and neuromuscular medicine to see the growth and development of other trainees around you. And my fellows will often remark on how fulfilling that experience is. From a research standpoint, we've really done well to roll out a research mentor program where you're paired with a faculty who shares a similar area of interest that research could be done on. So we try to find a nice fit for you. And a lot of the research efforts do lead to not only presentation within our intramural forums, like our training research day, but also to national organization meetings. And we also tend to have these research efforts culminate in publications. And, we have a smattering of some of the high impact journals that our fellows have published in, and this is just in the last few years. So it's a really good crowning achievement to be able to do that. And we're proud to say we facilitate this very often among our fellows and the great work they do in research. A little bit about the faculty. So certainly when you interview here, and if we have the opportunity, we'll talk more in the breakout sessions about the various faculty and their areas of interest. And again, one of the advantages that we have a lot of niche subspecialties within the neuromuscular field represented in our faculty. So if again your interest is in, let's say, autonomics or motor neuron disease or neuromuscular junction disorders and things like that, there are multiple faculties who are practicing and along niche specialty lines that gives you, and then those faculty would be able to be served as good coaches and mentors for you. I'll belabor that beyond showing you the various faces and names here. Apart from the neuromuscular medicine staff, we do have Dr. Yini, together with Dr. Prieston, our esteemed neuropathologists, and they do a great job in providing a lot of the neuropathology underpinning for your training. There's a lot that one can learn from the experts who have been able to publish very eminently, including having you might know Dr. Prieston from his textbook. I will show you a few of the textbooks that are produced by our staff here. You'll see many. All these textbooks have authors and editors who are on faculty here. So very proud to say that you'll be able to learn from those who have great impact on the neuromuscular field, not only through the teaching they do with fellows here intramurally, but through their work and their impact outside the Cleveland Clinic through their publications, including not just journals, but textbooks, their lead roles in neuromuscular organizations and advocacy, etc. So a little bit about Cleveland. I'm originally from the Caribbean, so me being here in Cleveland might sound like a bit of a misfit. I'm certainly outside of my natural habitat, but it does speak to something that is a great draw here. Apart from just working at the clinic, which is a great place to be, I've been here for over 10 years now, and I could speak to Cleveland being a very diverse and exciting place. I think it's a bit of a hidden gem. And I think, even if your persuasions along the line of fine cuisine or the arts or the great outdoors and recreation and theater, we have it all here in Cleveland. And I'll be happy to talk more about this as well when we have our breakout session. This is a lovely picture I took. This is the view the fellows have from the fellows room. Obviously, it's a lovely sunset there. This is a window facing west. All right, it was a pleasure sharing a little bit about our program. And again, I look forward to talking more about it in the breakout sessions.